She was sitting upright when she first went into the hospital. When she came out, she had to come out in a wheelchair, and she couldn't even lift her hand to her mouth to feed herself. She was really badly deconditioned, and her spine was bent over, her head was dropped. She certainly didn't seem like she was dying, but they were telling us that she was dying. And I had no experience of this before, so like, you trust what the doctor says. You're asking us to end Mum's life, and you need to know in 30 minutes because you want to get away for your long weekend. I said to the nurse, where's my mother? And she looked very flustered. She went, what? Oh, I don't know. And then I thought, well, that's very strange. How can you not know that a patient's disappeared? All of her normal drugs for her heart and her blood pressure, they were all moved very suddenly. All the observations were stopped. She was obviously put on morphine and midazolam. And the doctor knew that that would kill her. And is that what happened to her?
I'm delighted to have with me today Lorraine Norton. Now, Lorraine, your story is unfortunately very, very upsetting and very tragic, quite abhorrent actually, because we're talking about your mother who's called Elsie, and very sadly she died in hospital because she was put on the end-of-life pathway without the consent of yourself or any of your family members, and of course also without your mother's consent either. Could you tell us first of all just a little bit about your mother, your beloved mother Elsie, and events leading up to, I believe, her first hospitalization in 2016?
Well, Mum, she loved being with people. She particularly liked being surrounded by young people. She had a lot of friends much younger than her age, and she loved dancing, and our house was sort of like a counselling centre. She liked to help everyone. Everyone came to her with their troubles. And there was a particular time when a relative of ours became homeless and moved in. It was actually a council house. Mum didn't own her own house. The council knew that the person had moved in with children. And there was a strange situation going on, causing a lot of stress in the house, which affected Mum. She used to often sort of ring me saying, oh, I don't know what to do about this, and she was very stressed and crying. And then I had to go away on an update course, and during this time Mum was complaining that she didn't feel well and was taken to the hospital, and they decided to do tests. But apparently, so I heard when I came back from the course, they gave Mum a test for dementia, but they didn't take into account, I don't know if they were even told that Mum had dyslexia. So if Mum changed her mind, if she answered a question and then changed her mind, or if she wasn't sure about things, it counted against her, and they said that she had dementia. They were asking her questions like members of parliament, names of people in the government, and although when Mum was younger she kept up with those things, she didn't have time to read a lot. She didn't really like watching television very much. So I don't think she knew some of the names, but because she didn't know the names, apparently that meant she had dementia. So anyway, she got this diagnosis of dementia, and initially they said that she might have Parkinson's as well. So she was taken into hospital, and she was there for about 2 months, I think. I didn't really know at the time that when elderly people are not moved, they're not allowed to move, that their muscles deteriorate so quickly. I'd never had any experience of that. And apparently the first night that Mum was in hospital, she tripped and she cut her arm because the room was so crowded, and she tripped over a badly placed stand when she was going to the toilet. And so they didn't allow her out of bed from then on. Mum went in there able to walk unaided around the house. She walked in the street with the aid of holding on someone's arm usually. She could wash, dress, feed herself, toilet herself, everything. She was fine. And when she came out of the hospital, she was sitting upright when she first went into the hospital. When she came out, she had to come out in a wheelchair, and she couldn't even lift her hand to her mouth to feed herself. She was really badly deconditioned, and her spine was bent over, her head was dropped. Then, like, when I realised the extent of what could happen, I rang the hospital to complain, and they said, actually the physio is on the ward, you can speak to her, she's here. And she said that she admitted that Mum had had no physio. And because of that, it became very difficult to sort of lift or care for Mum, and Mum went into a care home. I took the case up with the hospital, and they refused to give Mum any corrective physiotherapy because they said it was no longer their concern. It was the concern of the GP and the community services. So I went to the GP and I said that I felt, Mum needed urgent physio, and it was some time later when she did actually get just 2 sessions of physio, and they didn't really do very much except talk to her and both get her up and walk her about 3 steps, sit her down again. So I went to see the GP and I said, I feel she needs more physio because of the bad deterioration. And basically he tried to intimidate me. He said, so you've complained about the hospital, and now you're complaining about, the care home didn't sort of walk Mum enough or see to getting a physio enough. Now you're complaining to me. Have you got any friends? Like, how about your family? Do you get on with them? Do you have any complaints about them? And he basically tried to intimidate me as if I was paranoid about everyone. And the next time I went to see him on Mum's behalf, I was left sitting in the surgery for ages, and when I went to the reception and said, I've been waiting ages, other people are going in, she said, I'm sorry, the doctor's refusing to see you. She rang him and he said he was going to refuse to see me.
You can't surely do that though, isn't it?
I'd gone up there on Mum's behalf. She asked me to go and he refused to see me. Anyway, so Mum stayed in the care home and then deteriorated quite a lot because she didn't really get the physio that she needed. I did actually inquire about getting a private physio, but for someone to come to, to leave their practice, come to the care home, give physio, go back and potentially miss clients at the practice, it was tremendously expensive. So sometimes I used to try to walk Mum myself, but she really needed physio to help with her back and her dropped head. And initially I asked for a collar, supportive collar for Mum, and they said no, because it would be really bad on the spine, where the neck is, the cervical spine. And then quite a while later, when the whole situation had gone much too far, I went in one day and saw Mum with a collar. So I contacted the physios and said, I don't understand, like you said a collar was bad for Mum, it would actually cause her more harm, and now she's got a collar. Why is that? What's happened? And they said, well, it's because you asked for one. So that really didn't make any sense. If they're supposed to know what they're doing, and one minute they say she can't have one and the next minute she's got one.
Yeah. On your advice.
Yeah, and I'm not a physiotherapist, so it was all very strange. Anyway, things went on. I don't think Mum had the best care in the care home. I used to go in and spend about 5 hours of time with Mum to feed her, hydrate her. I used to take her out a lot to the local shopping area, to the restaurants, so that she'd have a decent meal. I used to clean all the wardrobe out because all her clothes are always in a muddle in the care home. Anyway, that went on, and then at some stage Mum told me that she didn't feel well, and I contacted the head carer, and she said, oh, I've called the doctor. The doctor said she's absolutely fine. So then I went in, I don't know, a day or 2 days later, and Mum was saying to me, no, I really don't feel well. I've got pains in, around my lungs and everything. And so an ambulance came and they took Mum into the hospital. And I always remember that Mum said, I don't want to go because if I go into the hospital, I never come out. And that turned out to be true. Mm. So it's a sort of regret of mine that we made her go to the hospital, but then she did need to be treated for pneumonia.
This was 2018, isn't it? And the
yes.
first hospitalisation was 2016.
Yes.
How old was your mum in 2018?
18. She was 89. Yeah. She was 90 in the July 18, and so she went into the hospital. And they did treat her. Oh no, initially, that's right, they were going to discharge her again, saying there was nothing wrong. And then my sister rang me and said, oh, I'm a bit concerned because her breath is rasping. So I said, well, could you find another doctor to give a second opinion, which she did. And the doctor said, there's no way this lady can be discharged because she has pneumonia. So they kept Mum in, they cured her of the pneumonia. The only thing I had about that ward, I mean, they did really well in curing her and caring for her, but I was in there one evening and I noticed that the drinks and the food were on the side table and then taken off again, and no one bothered to obviously feed her or hydrate her. And I just went in and they started removing everything.
That's very cruel, I was thinking, because
yes.
you basically got the food there and the drinks, but they're out of reach. That
yes.
sounds quite cruel.
Yes.
And I was thinking about it earlier, that sounds to me as something illegal, because you've got to be able to hydrate a patient. You're supposed to be able to provide nourishment and food to the patient. But in this case, it's clear that they didn't.
Yes. And I mentioned it to the person. I don't think she was a nurse. I think she was one of the care staff, that Mum hadn't even touched the food, or she couldn't reach the drinks. And she said, oh, we just don't have the time. Then Mum was moved to an upstairs ward. And as soon as that happened, my sister and I got called into a room by a doctor who told us that Mum was dying. And that was a bit of a shock because we had no idea that she was dying. And I think we were just so taken aback. I didn't even say, well, what's she dying of? Like, she's been cured of the pneumonia, what's she dying of? It's just like a shock.
Yeah.
And
did she seem more unwell when you saw her? When they made this
not really.
statement?
She was a bit more tired and a little bit more, I suppose a little bit more lethargic, but then she'd just got over pneumonia, and she hadn't really been fed and hydrated properly. So, but she certainly didn't seem like she was dying, but they were telling us that she was dying. And I had no experience of this before, so you trust what the doctor says.
Of course.
I said, well, they said, would you agree to a do not resuscitate, DNA? And we were supposed to be given a choice, but we were told that if Mum were resuscitated, she could have had severe internal bleeding, really bad bruising, broken sternum, broken rib cage. Who would agree to that if someone sort of 89 or 90 years old? I mean, you wouldn't say, okay, yes, well...
You can't make an informed choice with that information, isn't it?
Exactly. Yeah. So, anyway... and
it's not all completely true as well. I think this sounds like an exaggeration to me, having read into this.
Yeah. Yeah, I mean, when
you
you're
hope
told
to do CPR, isn't it? Where possible.
When you're told that, I mean, it's a bit of a shock, really. So you don't always think of the questions there and then that you want to ask, but they could have used, it's not necessarily that some massive person is going to perform CPR. They could have used one of those defibrillators, or I'm sure that one have caused all the bruising and the internal bleeding. But we just didn't think at the time because it was all a bit of a shock.
Of course.
So we did actually agree to no resuscitation if Mum died. Then I said, well, if Mum is dying, I know that it's her wish that she doesn't die in a hospital. That's one thing she's never wanted. And if she is dying, I know of a very good hospice that my friend's sister went to, and we prefer for Mum to go there. And the doctor said, well, we do have a gibbard ward for end of life, and we could move Mum there. And I said, well, please don't, because I know Mum, she wouldn't like that. And I don't want to go against her wishes. And then we returned home, and I think about a day or 2 days later I had a phone call, and I was told that Mum had taken a turn for the worse and she couldn't be moved anywhere to a hospice. She couldn't go to a hospice. And they said that they'd moved her to the gibbard ward, the place where we'd told them not to move her. And I happen to know that the gibbard ward meant that Mum was moved down three floors, could have been 2, but I think it's 3 floors at the front of the hospital. Then you go right through the hospital grounds, which is quite a long way towards the back, and then into the ward, and then obviously into the bed. And I said, well, if she's not allowed to be moved anywhere, how did you manage to do all this? and out in in the cold air through the hospital ground. So there was no response to that. And then when we visited Mum on the gibbard ward, well, I certainly did. I haven't asked my other relatives, but I felt hounded. I used to think, get into the ward quickly and sit by Mum, because I didn't want to be dragged in a room and be asked, put your mum on end of life again.
Oh, that was happening a lot as well.
It happened quite a few times, and I just thought, I just want to spend time with Mum. I don't want to sit discussing, putting her on end of life. And
so
I knew
very
that
negative.
Mum wanted to live longer, she told me. She actually said to me, I want to live a few more years yet. I'm not ready to go yet. And she actually said to me once, Mum, Lorraine, can you get me out of here? Get me out of here. And when I told the doctor that, the doctor said, oh, she's got dementia. But no one, family, friends, visitors, they all thought, they used to say to me, your mum's not demented. She's not got dementia.
Well, the test that they're conducting, when I read your online testimonial, it said that, the way they conducted the test, like you said, they didn't take in the dyslexia into account. They didn't, even the questions, as you said, but also you said that if your mum didn't respond very quickly, they assumed that to be dementia. And I think you said also if she gave the wrong answer first and then she gave a correct answer second time, they still discarded the second answer. But we all can do that. It doesn't mean we've got dementia.
Exactly.
It's very strange, isn't it? So that certainly is very spurious.
And then, we were asked several times about putting Mum on end of life and said we didn't agree to it. And I remember one occasion I was called into a room with an older doctor and a young doctor. And the older doctor asked me to say what Mum was like as a younger woman. And I found that sort of quite upsetting because of her condition, and they were telling me she was dying. Like, to think of her then and to think that she was dying, so they told me every so often. I just, as I was talking to the doctor, I had just a couple of tears rolling down my face. Like, I wasn't sobbing uncontrollably. And she got up and she patted my shoulder and said, there, she said, you can't cope with the fact that your mother's dying, can you? Which I felt was very patronising. And
very manipulative as well.
Yes, exactly. Again, like the doctor in the surgery, sort of like insinuating there was something wrong with me. Who would be happy about their mother dying? I don't know. So that sort of thing went on.
You had the treatment escalation plan that was, you
Yes.
didn't know about it, you said at the
Yes.
time, but they certainly knew. So when they did that plan, they actually asked the medical staff there, or some members of the medical staff, whether they thought your mother would make it past the 12 months, and they said yes, of course.
Yes, I found that in the medical records. After Mum passed away, I got all the medical records, and I found the TEP form. Yeah, would you be surprised if this patient died within the year? And they said yes, they would be surprised, which means to me that she wasn't dying at all. That's like horrendous.
Yeah,
And
it goes against everything, really, isn't it?
Yes.
If you're going to keep pressurising
Yes.
you and the family members to put her an end of life, why would you do that?
Yes.
If you know, there's no chance of, or certainly no likelihood of, you know, death within 12 months.
And then once I went into the hospital, sometimes she did look a little bit worse than others. And I noticed that her earlobe was pressed up, bent up against the rest of her ear. And I went to go like that and it wouldn't come down easily. And there were cracks in her ear. And I thought, Lady, she's really dehydrated. She did sort of seem a bit, you know, not quite with it. And I was thinking initially, well, maybe she has got dementia. Anyway, my mother liked mango juice, and I brought some mango juice in, and I gave her, I just put the straw to her, and to her mouth, and she sipped some. And then as she sipped more and more, she sort of sat up a little bit, and she kept saying to me, more, 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 like as if she really needed to drink.
Wow.
And she finished the whole of the 2 mango juice tubs off. And then after a little while, she started acting normally. And again, that happened before when they said, oh, we can't feed her. And I was there at meal times once, and I sort of sat below so that I could see, because she had a dropped head, so I could see she was swallowing properly. And I fed her nearly the whole of her meal. But I don't think that was happening when people weren't there to feed and hydrate her.
Yes, and I remember you wrote that it seemed like she, after those meals and the mango juice, that she did perk up a little bit, isn't it?
Yes, and she was like jokey, and she used to like teasing people, my mother, like she'd be quite, you know, have jokes with them, and she was very sharp-witted as well. I can't think now what she said, but she'd sort of might say something to the nurses or the doctors, you know, like as a little joke. And she started to come back like to her normal personality. And there were occasions, you know, my son went in once, and Mum had arthritis, so when she moved, it could be a little bit painful initially, and she had this habit of going, ooh, ooh. And then after that she was fine once she settled. And my son was there, and he said the nurse came over with a syringe, and he said, what's that? And she said, oh, morphine. And he said, well, why are you giving her that? And she said, well, she's in pain. I said, no, she just moved, she's fine now. I said, no, I need to give her the morphine. And my son said, Elsie, are you in pain? And my mum said, no, I'm not. And my son told the nurse to go away with them. She doesn't need the morphine. And he was there another time when a similar thing happened, and he said, what's that? And she said, oh, it's and she changed it, and she then changed it to something else. So he thinks that was morphine as well.
Wow. So when your son or none of you were there, this may have been happening
exactly
in your absence.
Exactly.
It's really shocking, isn't it? Because you as a family, you know, for example, what you just mentioned about your son, you know so much more about your mum. And this is the tragedy of this whole thing, that even though you have great knowledge, because she's your dearest family member, that they don't seem to take that into account, that your wisdom and your experience and your love and tenderness and care for your mum, as well as your son and others, that they didn't seem to take this into account, even though it was clearly far more effective than their methods, I think.
Yes, because you know your own parent, or you know who you share a house with for a long period of time, and you know them for many years of their life. You know them, and unfortunately, doctors often don't take that into account. They treat everyone, well, almost like you know, a replication of the same machine, whereas human beings are not machines, and there's probably far more sort of intricate things going on in any sort of individual, and we're not all exactly the same, and they don't really take that into account.
Yes, we all react differently to every situation.
Yes. So that happened, and then we were called in about putting Mum on the end of life by one of the registrars there, and we said no, and he said it was very undignified to keep her alive, to keep someone alive.
Wow.
And he apparently was off that weekend, and I think it was a Friday, Friday, and he got very irritable, and he said, well, I need to know in the next 30 minutes because I'm off for the weekend and I need to get away. And then I'm sitting there thinking, you're asking us to end Mum's life, and you need to know in 30 minutes because you want to get away for your long weekend. And it didn't strike me that they were very caring at all. And he left because, you know, we didn't say that we wanted Mum on end of life. And then about an hour or half an hour after he left, a young doctor came in, which I'm assuming was someone under his training, and she said, he's asked me to come in about putting your Mum on end of life. I explained to her, I said, but Mum wants to live, and she's not actually dying of anything, and to me it feels like, you know, we're murdering her. And actually this doctor was very nice, a young African doctor, and she said, yeah, I understand, and she just left us, and she didn't pester us. But when I said to her, you know, the doctor that sent her in, about it felt to me like we were murdering my mother if we did that. He said, oh, don't think of it like murder. Think of it as you're doing her like a favour almost, because you're saving her sort of, you know, more suffering. But as far as I could see, she wasn't really suffering. So these things went on, and it started to feel almost like we were hounded. Well, that's how it felt to me anyway. I don't know about the rest of the family. You know, and blamed. I remember another meeting where somebody wanted Mum to be put on end of life, and being told that, well, you can't cope. You can't cope with the fact that your Mum's at the end of her life. Well, you know, they're sort of like blaming the person that they're trying to victimise. I said, it's not that I can't cope with of course I know my mother's going to die one day, like she's getting older, but I can't cope with the fact that you're asking me to consent to killing her. So that this went on, and then there was another meeting one Wednesday with the same registrar that had to run off for his weekend. And I remember he came into the room very bright and breezy. I remember the way he walked in and he clapped his hands and he said, oh, good news, good news. And he said, your mother's fine. He said, she's fit for discharge. Your mother's fit for discharge. So I said, what about infection? Doesn't she have any more? He said, oh, no, it's negligible, it's minimal. No, she's fine. He said, she's fit for discharge. So he said to us, so 4 members of the family were there, if you agree that she needs no further treatment, we can fast track her to any hospice care home of your choice, anywhere you want your mum to go. We can fast track her if you agree that she doesn't need further treatment. Well, of course we agreed, because we were just told that our mum was fit for discharge and in good shape, is the words he used. So why would she need further treatment? And we wanted to get her out of the hospital, and I wanted to get her to the good hospice, because there was also a rehabilitation unit there. It wasn't just a hospice for the dying. So we agreed. And then I couldn't get in on the Thursday, That was the Wednesday afternoon. And then on the Friday afternoon, I went back and there was a call from the same person who I'd had a little bit of an argument with when she told me that Mum would be moved to the back of the hospital. And I think she thought that she was ringing me and that I was at home, but I was just outside the hospital and I didn't tell her that. And she said, your mum's taken a turn for the worse. Well, this is another thing. Twice when we were told Mum had taken a turn for the worse, both occasions were after I'd said Mum wanted to go to a hospice. And the first time I said that, I almost got shouted at down the phone because she said, oh no, she said, well, no, not a hospice. She said, that's far too much work for the hospital. There's a lot of admin because it goes through the clinical commissioning body. It doesn't go through continuing nursing care like care homes. It was far too much work for the hospital. So I sometimes wonder if it was the fact of Mum wanting to go to a hospice that that she suddenly took a turn for the worse and couldn't be moved anywhere. But I haven't got proof of that, but it just seems a bit of a coincidence. So anyway, she told me Mum had taken a turn for the worse, and she said, we're going to have to find a bed for her later. We're going to have to move her to a side room. So I said, fine, I put the phone down, and then I went into the ward. And as I looked to where Mum's bed was on the right, the whole bed was stripped. Mum wasn't there. All Mum's things had moved. And I said to the nurse, where's my mother? And she looked very flustered. She went, what? Oh, I don't know. And then I thought, well, that's very strange. How can you not know that a patient's disappeared? Like, why haven't you been informed? Because there should be handover for nurses. Anyway, she went off to find out, and she came back and she said to me, oh, she's in a room at the end. And I went down this corridor, and there was a nurse, 2 or 3 nurses sitting at a desk. I think 3 usually sat there. And I went into the room, and when I went into the room, Mum was just lying there immobile. I thought she was asleep at first. And then I thought, I wonder if she knows I'm here. And I said to her, Mum, do you know I'm here? And she just flickered her eyelids and raised her eyebrows. And I thought, I wonder if that's a coincidence. So I waited a while, and I said the same thing, and she did the same thing. So I knew that she knew I was there, but she couldn't respond to me. I didn't really know at the time that she was on morphine and Midazolam, which obviously Midazolam would have not allowed her to respond. I got Mum's medical records after Mum passed away, but I can flick through them, but I can't sort of read the whole lot because I find it sort of upsetting, because obviously then it brings memories back, and when you're told these things, it's a bit of a shock, and you don't always sort of ask the questions that, like, in retrospect, you think, well, I should have asked this, I should have asked that, but you just don't think at the time, and you sort of trust the doctors, really, I suppose. So I checked that Mum was okay, by asking her if she knew I was there, and then I knew that she was aware, but she was just unable to respond or speak, which I think if somebody is dying, that's the thing that they'd most like to do, I would imagine. And my son asked a nurse to take Mum's blood pressure, which she did, and the registrar, who had wanted Mum on end of life, he told the nurse off, and he said that she shouldn't have done that because it's no further treatment, and that includes observations.
This is like they've given up on her completely, isn't it? Yeah. You would think that you would want to try in every possible way to give hope and to try to treat someone. You're supposed to be giving them the best quality care as well, isn't it?
Yeah.
It seems very counterintuitive to human nature.
So I think my son or my sister stayed that evening, and then one of them stayed on the Saturday evening. That was the Friday, Saturday. And then I stayed on the Sunday evening, And during the night, I heard Mum's breathing becoming very, well, it sounded very strong, actually. And I was thinking, because Mum's a bit of a fighter, I was thinking, oh, maybe Mum's overcoming, you know, whatever they've given her. Maybe she's coming out of the sedation, and maybe she's coming to. But the nurses came into the room and said, oh, your mum is really very, very warm. She's too warm. We have to take the covers off. And then I said, she was breathing in a very strong way a moment ago. Is she okay? And they said, yes, she's absolutely fine. It's just because she's breathing through her nose. I don't know why that would cause someone to breathe that manner, but that was their explanation. And then I asked them again, a bit later on, about the breathing, and they said she was absolutely fine. And then the next morning, I said to Mum that I'm just going to go and make myself a cup of tea. I'm coming straight back. And as I went to walk past Mum, I saw some liquid. And I said to Mum, oh, I just wipe your mouth, you've got some liquid. And I said, I'll be back in a minute. And then as I went to go out of the room, I turned and I saw more liquid. And I went to Mum and I said, oh, Mum, you've got more liquid coming from your mouth. And I wiped her mouth. And as I wiped her mouth, her head fell to one side and she passed away. And
I'd be sorry to hear.
Yeah, I knew that, like, obviously I saw all the colour drain from her face. I knew that she died. And I didn't really expect much from the doctors or the nurses. So I stayed with Mum for a while and I just prayed, because I thought, well, I know when people die, the hearing is the last thing to go, and maybe like that will give her some comfort. And then when I went out and I told the nurses my mum's passed away, they didn't even look up from their desks. They carried on writing, and one just said, oh, has she, like that, which annoyed me. And I said, I've just told you my mum's passed away. I haven't come out and said, you know, asked you to move a wardrobe. I've told you my mum's passed away. And she just sort of looked, and I went back into the room. I called my family. And the nurse had said, oh, we'll send for the doctor to confirm Mum's death. And the registrar came along quite a while later, and he went in to examine Mum. And I was waiting in a tiny little part of the room that, you know, went into sort of an entrance exit. And as the doctor came out, I stood up because I thought that he would say, oh, Mum died of such and such, or are you okay, or do you need anything, or my condolences or something. But he brushed past me and he just smirked. And it was almost like, oh, I've got my way, like, you know, I wanted her an end of life, and that's it. He just smirked. And by the time my family arrived as well, after that, I was in floods of tears when he walked past me. He just didn't even say, would you like a nurse or anything.
No empathy at all?
No, nothing. And then my family arrived, and we were sitting with Mum for a long time, and then we went to sit in the reception area. And we saw that doctor twice, and he didn't come up to the family once. He didn't say anything. He just walked past us as if nothing had happened. And when we were in the room with Mum, the nurse came in and she said, "Oh, we need the room. You'll have to move her now." I was like, I don't believe these people are actually care workers. I think, and we said, "Well, we didn't know she was going to die. We don't have anything. We can't take her things." And she said, oh, she went like that, and she came out with 2 big plastic bin liners, black bin liners, and she said, "Oh, we can put her things in there," like that. I was like, the family, we were all looking at one another, thinking, is this really happening? And then my son said, "Well, I don't have a car with me today." And she said, oh, we keep them in the nurse's office, but you'll have to collect them first thing tomorrow morning because we can't keep them in there for too long. And this is how she was speaking to us. And
so cold.
My son just got hold of the carrier bags and he said, don't worry. He said to me, I don't ever want to set foot in this place again. He said, don't worry, we won't be coming back here. So he went out, and there was an incident that I found, sorry, it was quite touching, but it sort of was quite odd. As I went to go out of the door, one of the nurses, one who was particularly very good at her job, she didn't laugh or engage in conversation, but you could tell she really wanted to do her job very well. As I went to go to the door, she got hold of my arm. She tapped my arm, and I turned around and she said, I just wanted to say I'm very sorry for what happened to your mother. And I didn't think about it too much at the time. So I found it very touching because she was the only one that showed any sort of humanity or humaneness or empathy. And but when I look back, I actually think that was a very strange phrase to use. I'm very sorry for what happened, not I'm very sorry that your mother passed away, or my condolences. And I thought, well, what did happen to her? I don't know. Was she, all of her normal drugs for her heart and her blood pressure, they were all moved very suddenly. All the observations were stopped. She was obviously put on morphine and midazolam. And the doctor knew that would kill her. And is that what happened to her? Is that what the nurse meant? And anyway, I thought there's something suspicious because the registrar put down that she'd actually died of aspirate pneumonia, but we were told that she was cured of that.
Yeah.
So I went to the coroner, and in retrospect, I wish I'd have got an independent coroner, but I went to the one that normally deals with the hospital. And Mum died not of a heart attack, but of a changed heart rhythm, which I think, I'm not a doctor, but I think might be due to taking Mum off some medications which shouldn't be stopped abruptly.
Yes.
And then obviously the morphine, the morphine and the midazolam interferes with the breathing and it causes sedation. Well, to me, it sort of feels like murdering somebody that when that happens. It doesn't feel like a normal death.
No.
And yet you're expected somehow to get over it. And the coroner put down that Mum died of changed heart rhythm, and they also put dementia on there, but she didn't die of dementia. She didn't have. Well, if she did have, it was so minimal that she certainly didn't die of it. And he put frailty, but they hadn't been feeding or hydrating her, so she would have been frail. And then he listed at the bottom every single thing he found that Mum had that was wrong with her in her body, but she wasn't actually dying of those. So why that was listed all on the death certificate, I have no idea. And that's why I wish I'd have had an independent coroner.
What did you draw from that when they put all those conditions there?
I assumed it was to make the hospital not look as bad, because look, she had all this, so she would have died anyway. Well, we know that she would have died anyway, she was 90, of course she would have died anyway. But we're all going to die anyway.
It doesn't matter, isn't it? Age doesn't matter. The point is that if they're interfering and without your consent, without your mother's consent, if they're doing that, in this country at the time and even now, still, despite the assisted dying bill looming over us, it's still, this is involuntary euthanasia, isn't it? And that's not acceptable.
I in my opinion, it's like murder.
Yes. Absolutely.
Yes, we're all going to die, and if we could all be thoroughly looked at by a coroner, I'm sure we've also all got things wrong with us. But listing every single thing, I just thought, you're doing this to make the hospital look a bit better.
What prompted you to look towards the medical records once?
Because I thought that there was, I began to think that there was something suspicious going on. The fact that I was told my mum had dementia, and I used to go into hospital and then realise she was very badly dehydrated, and that when she was hydrated, she suddenly got her cheeky sense of humour back, and you know, she was more complaining and more aware of things. And I thought, well, you know, you can't have a person that 1 minute they're dying and then the next minute they're not. They're either dying or they're not dying. Like, surely, and when I had actually said that to one of the doctors, and she said, oh, well, sometimes when people die, they get, well, when they're dying, they get a sudden burst of energy for a few days before they die. But I thought, but even that doesn't make sense, because, yeah, maybe that happens, but surely they're dying, and then the last few days before they die, they get a burst of energy, but they don't die. They're dying, then they're fine, then they're dying, then they're fine. Surely that's not normal. So I began to think things were very suspicious, and that's why I decided to call the coroner to investigate. And then when I got Mum's medical records, I found the TEP form. I haven't looked through how much sort of morphine and midazolam Mum was on, and I haven't looked through everything in detail, because I find it quite upsetting sometimes to go through everything.
Understandably.
Because then I sit and think to myself, well, why didn't I say this? Why didn't I do that? Why didn't I check this? But I don't think I should have had to do that, because they're under the care of the medical staff. But anyway, that's how I feel sometimes. But I found the TEP form saying that they didn't expect Mum to die within the year. So why would they keep asking us to put her on end of life? And I also found an A4 page by the doctor that had put her on at the end of life, claiming that there were 2 doctors present, and there wasn't, there was just him. And I have a suspicion that the other doctor he's named was because it's an African sounding name, was the young doctor that he sent in to check that we wouldn't put Mum on end of life. And I have a suspicion that he was her superior, and that maybe if it was questioned, she might say she was there, because I don't know. But anyway, it's a suspicion that I have because of what's gone on. He said that the 2 doctors were there was only him, and he said that the family asked for Mum to be put on end of life. All the notes in the A4 page were completely false. He said that we asked for Mum to be put on end of life. So there was that occasion when all the medical records were false, and then the previous occasion, the first hospitalisation, when Mum didn't have any physio, it was stated on their medical records that Mum had had 12 sessions of physio. So they were false. So I'm not inclined to trust that hospital for anything, basically. And I had 2 parliamentary ombudsman cases, and I told them in both cases that the medical records were false, but they insisted on using those false medical records, and they found no fault in both cases.
Even though you were four members of the family.
Yeah. And when I
corroborating everything.
Yeah. And when I approached the GMC, General Medical Council, they said that they couldn't comment on what we think we heard or how we interpreted it. So, and that they don't think the doctor did anything wrong because he'd followed the guidelines of end of life and end of life care. And I wrote back to them and I said, well, in other words, you think we all had some sort of mass hallucination, because like we all heard the same thing, we all interpret. How else do you interpret someone coming in saying, your mum's in good shape, she's fit for discharge. How else do you interpret that? And then she's put on the end of life, and he's written a whole page of false medical notes, and they didn't reply to me.
It's shocking because we knew that there was this palliative care guidelines called the Liverpool Care Pathway, but that was ended in 2014 because people were being put on those pathways without their consent or their family's consent. They were also being dehydrated and not fed. So many other things were going wrong. Many other things were not properly implemented, leading to the death of innocent people in the most cruel way. Being murdered effectively. And yet here we are in 2018 when these guidelines should never have been in place, but they're still taking place with your mother and so many other people I've heard of this happening to as well.
Yes, I found a lot of, I found quite a few support groups and campaign groups, and there are a lot of people that have had this experience, not just with their elderly relatives, but also sometimes younger relatives, like young sons and daughters that have needed a lot of hospital treatment, suddenly being put on end of life. And I personally have 3 friends, all within like a couple of years of one another, who all had their parents put on end of life. And one friend of mine, she actually had a breakdown because of it. She had a really bad breakdown because of it. Yeah, that's why I don't trust, like, the assisted dying bill. I personally wouldn't trust it. I don't feel, because I've had, you know, these instances of false medical notes on 2 occasions. And, yeah, and I personally, and doctors, like, urging us to put Mum on end of life and telling us she was dying. And the TEP form shows us she wasn't. So I don't have any trust in it. And when I used to work in hospitals myself, I did psychology and counselling training. I worked on mental health wards. I've worked with various patients. People can change their minds. So if someone tells you they're seriously depressed and they want to die, you know, and a few months later, you know, they want to be getting on with life and taking a course or doing something different. So it's very, yeah, I don't trust the assisted dying bill.
Well, it could be open to abuse, isn't it? And the abuse could be, if we have these kind of protocols in place, then people who are not going to die, as you say, in the next 12 months or not for many years to come, they're being put on these pathways. And with an assisted dying bill, if it's happening now, where it's still you know, criminal offence of very serious nature. Well, what happens if we start to create this bill, which is looking like it may pass soon? Then we're open to greater abuse. But also, I think the other danger is, like you say, if someone's terminally ill, presumed to be terminally ill, but they recover, which does happen a lot.
Yes, it does,
and if we give up, then of course we won't know, but if we at least try to treat and try to look after and provide quality care, there is a chance that the person will live. Surely we should always believe in the sanctity of life, but that seems to be being eroded at the moment, against the wishes of the individual and the wishes of the family as well. So I know you're doing some campaigning at the moment and have been doing for some time, and you want to set up something called Elsie's Law in the honour of your mum. Could you tell us a little bit about your campaign? What do you hope to achieve?
It's a petition. Well, I'd like to get as many signatures as possible so that Parliament hopefully will look at it. And what I hope to achieve is that people don't have to go through this. And sorry, this is upsetting. I think that it would help, instead of having doctors and nurses, you know, all working at the same hospital, I think it would help if there was a completely independent person, nothing to do with the hospitals or you know, the parliamentary ombudsman or any connected health service, completely independent, who would be there at these end-of-life decisions. I'm not talking about assisted dying, I'm just talking about end-of-life decisions when people are really dying in a hospital, because I've seen how medical notes, medical records can be falsified and then accepted as truth, and no one does anything about it. I've approached MPs, I've approached the GMC, I've approached the Parliamentary Ombudsman, I approached the patient liaison team at the hospital. I've been putting things on X, Twitter, for ages, and tagging in various members of the government and Parliament. I've written to a couple of MPs. I've approached loads of people in the media. No one seems to want to talk about it, and that's suspicious in itself.
Well, especially the fact that the assisted dying bill went through the House of Commons, through Parliament really, and most MPs, it seems, obviously voted in favour of it, which may tell us why they're not responding, because they seem to be in favour of assisted dying, which is a real concern, I think. But on a positive note, I just want to add as well that next month there is a very big case. It's going to be heard by the senior coroner, so it's a big hearing, and it's related to a family who've managed to get this through, and they lost their elderly loved one who sadly was put on an end-of-life pathway and given Midazolam and morphine. They said apparently to such an amount that it would kill an elephant, and all he had was gout, which is,
yes,
you cannot understand
I
why,
read about that. Yes. Yes.
why you would even consider putting someone on end of life for just having gout. So thankfully this has got to that stage after 5 reviews. There is a potential that if this case is seen as an unlawful killing, then possibly Midazolam at least, and this protocol NG163, which is very similar to the Liverpool Care Pathway, that this may be stopped, and people may be prosecuted who created this pathway.
Yes.
And I know we've talked about the fact that doctors and nurses and other practitioners have been very fearful to speak out for fear of the repercussions for their livelihood. But it's come to light that in this case, several doctors and nurses are going to be witnesses. Although I've heard that one of them had to move abroad because they're so afraid to remain in the country. So it just goes to tell you how much secrecy there is and how difficult it is to get the truth out there, that people have to be so afraid.
Yeah, and that's sad, because, you know, I guess most people become doctors because they want to help people, they want to save lives, you know, they're interested in, you know, how the body works and what medicines can save lives. And now they're afraid to speak out in case their careers are ruined. It's a pity that, you know, doctors are in fear of their jobs after all that training, that they're in fear of speaking out. And I do know, I have a friend who's a doctor who had a similar thing happen to his parent, and he's afraid of speaking out about it because of his future career.
Tell me, I mean, you tried to pursue the truth basically for your mum's sake, and for other people as well in the future, so this may not happen to them, but you found it a great challenge because you spent many, many years and you haven't been able to get very far, I think. Could you tell us a little bit about how you've been searching for the truth?
Well, initially I contacted the hospital patient liaison team, and then I went to the Parliamentary Health Service Ombudsman. The first case about mum's physio took 2 years, and the second case took 5 years. You know, and now, because I know that on both occasions false medical records were used, even though they were alerted to the fact that the records are false, I don't really have any trust in these connected services. And I have a suspicion that it's lasted 5 years, basically because I'm out of legal time. Yeah,
How
I mean,
convenient.
yeah, because the hospital weren't answering to like simple questions, and that's my suspicion. And the reason I've got the petition going is that I want there to be an independent person who will witness any conversations about end of life, any decisions about end of life. I'm not talking about assisted dying bill, I'm talking about cases where the hospital tell loved ones that their loved one is dying, and I think, and do they want them to be put on end of life? Personally, I would never have somebody put on the Liverpool Care Plan, which is what my mum was put on, even though it's outlawed, because I don't think that somebody would want to be in a position where they can't communicate with their family.
It's absolutely awful. I think the COVID era, because they used COVID as a cover for the first wave of mass killing of the elderly, using actually midazolam and morphine, and because it became, sadly, a lot easier for them to do so under the guise of this lockdown, where we saw people, vulnerable people, put into care homes, moved out of hospitals, very ill people, that's why they were in hospital.
Yes.
Put into care homes where they're not in a clinical setting. There's no GPs coming to visit them, very few, if any, people coming to visit, no families allowed to visit, and they're isolated. Imagine some people with dementia, isolated, locked up in a place like that without any family contact, without medical assistance, and then being potentially put on midazolam and morphine. So we saw, huge numbers of people. And so many now have come forward that I really hope that with this coroner's hearing, as well as in 2023 in June, actually the House of Commons hosting a meeting where 50 bereaved families were able to bring their cases forward for the misuse of midazolam during just the COVID era. That's a huge number of people, that it's at least raising awareness. And finally, there seems to be some movement from the media as well. We've had Neil Oliver finally talk about, with Majid Nawaz, talking about these end-of-life protocols, that NG 163. So I really hope that this could be finally the breaking point where the truth comes out and lessons are learned, apologies are made, and some justice is also brought, so that this may never happen again. Could I just ask you for your final thoughts? What would you want to say to the public and to any people in authority who may take a look at the film?
Well, I think that when doctors train at medical school, obviously they must have their opinion on how to treat someone, but unfortunately now they seem to have to go through all these protocols. I asked if it were possible to do, to give mum, continue the medication, and they say no, it's either one or the other. We either have to stop everything and so they have to strictly follow these protocols. They can't deviate from them. They can't be doctors, basically. They're more like robots. And because of our experience, my family's experience with what happened to mum, unfortunately, I feel that you can't trust the health services. You have to watch your loved one. You have to watch like a hawk what's happening. You have to question everything, take photographs, take notes, recordings, because unfortunately you can't trust what's done. Forced medical notes that the Parliamentary Ombudsman's willing to accept.
Against 4 members of the family.
Yes.
It's insulting and outrageous.
Yes, it's insulting. So I would urge anyone going through this to get an independent witness there, to question everything, to get as much evidence as they can. That's all I can say, really. But
I hope they could be allowed to have visitors, as many visitors as possible.
Yes.
Not just the family, but other people who could almost be there nearly 24/7 while they're in hospital, because sadly, the moment people leave at night after
Yes.
visiting hours,
Yeah.
so much goes on during that period when you know the visitors are no longer there, and that needs to change as well. That if people want to stay longer, they should then be entitled to, especially with everything that's gone on. Sadly, I know it's sad to have to look at the medical profession with such scrutiny, like
Yes.
watching them like hawks, but the profession hasn't done itself any favours, really.
Yeah, and I think it's not always the individual doctors, it's the governing bodies that are giving all these instructions that the doctors then have to follow, and if they deviate, they're frightened that they'll, you know, be reprimanded in some way, lose their job, or, you know, it won't go well for their career.
Some of them must believe in these things as well, I think, because they've been so heavily
Brainwashed.
brainwashed, indoctrinated,
Yes.
that this is the right thing to do.
Yes, yeah.
There seems to be
Yeah.
a culture almost of giving up now earlier than, you know, rather than, again, I go back to that whole thing of the sanctity of life. And like you said earlier in our discussion, this is a Christian country, and so the sanctity of life should be sacred, but it's not just for the Christian religion. I think all religions and faiths have a similar idea of the sanctity of life, and even people who don't necessarily have faith often have that.
Yeah, sure.
So I don't quite
Yeah.
know what's happening, but whatever's happening is pretty horrendous.
Well, I just, my personal opinion is that, you know, they keep telling us that there's a growing older population, and it's going to be difficult to care for everybody. And then I think to myself, but for years we've been asked to support this campaign, that campaign, for research, you know, to help us all like cure diseases and live longer. And they must have known that there's going to be a growing population of older people to care for. So why didn't they put something in place to deal with that, rather than, how I see it, killing people off, you know? Because,
why are they doing it, do you think? I mean,
well, I think they're doing it because of financial reasons, because they've got to spend money on care, and, you know, they want to get hospital beds back. That's what I think, because I can't see any other reason why you would want to. You know, I've worked with elderly people in the past. You know, I was helping out in a dementia unit, actually. That's why I think my mum didn't have dementia, because I saw people with dementia, a lot of people with dementia. And, you know, there's something really sort of quite lovely about sort of watching elderly people, like they're quite sweet and they come out with all the stories of their past and everything.
There's so much we can learn from their experiences.
Yes, exactly.
Too,
and I think, you know, sometimes I'm sitting on the train and I see, with the other day, like a little old lady, and you know, she's on the tube and she's able to still get around. And I think there's something quite lovely about that, because the person is living their life until they can no longer live it, but not through someone putting them on drugs and killing them, you know. Yeah, so basically I've got the petition running because I want the whole thing looked into, and I want more people to become aware of it, so that their loved ones aren't, I'm going to use the word killed because that's how I feel, their loved ones aren't murdered. And it's you know, you can get over a death, but it's very difficult to get over something when you feel that your parent has been murdered, and been murdered by somebody that should have actually been looking after them and preserving their life.
High quality care, they said,
Yeah.
best quality care, and to try to keep treating them to allow them to live, and, you know, believe in the fact that they can still flourish. Just because they're
Yes.
old and frail, it doesn't mean that we can't revive them,
No,
heal
exactly.
them. We've got to believe that we
Yeah.
can.
Yes.
Believing the healing power of,
Yes.
of the body,
Yes.
and be there to support that healing, I think,
Yes.
rather than trying to say, I give up and that's it. Well,
And giving someone the nicest possible end of life, like allowing the nicest possible end of life. I know some people have terrible illnesses and they're in pain, and my grandmother died of cancer that spread throughout her body, but I don't remember her we went in and she knew we were there. She wasn't so heavily sedated, and I just think it's terrible what's happening. And I want to sort of live in a country where I trust the healthcare, and where I'm sort of proud of the healthcare. But I don't feel like that.
No,
I don't feel like that.
Keep far away as I can. I feel that it's so important now to take care of your health to the best of your ability, so that you don't end up there, because you're quite worried of what might happen, and that's not a health service that you want, isn't it? Where you're afraid to go there because the opposite happens to you.
Yeah, I've heard quite a number of people actually saying that, oh, I've got this wrong and I've got that wrong, but I don't want to go to hospital.
That's not,
I was like,
it's not where you want to be. But I mean, I guess, I know we talked about this earlier, I feel that people have outsourced their lives to external agencies too much, but of course I understand your point as well. Do you think perhaps that we still need the support of others, isn't it? Although we need some independence.
I think people should, they shouldn't just rely on the state for everything. I mean, I think, I think if you sort of achieve things yourself, you have better self-esteem. And you have better sort of satisfaction that you've achieved it yourself. But at the same time, we all need other people. Like when we were discussing earlier, like I said, like if you want a job, you get that from another person. If you want help on training how to do the job, you get that from another person. If I decide I don't want to work for someone else and I want to set up my own business, I need people to come and buy my whatever, my commodities or. It's
trust us. We want to trust people.
Yes,
don't we?
So you do need people. We're not like an island, are we? So we need people, but it's possible to be assertive and to take responsibility for yourself at the same time as needing other people.
Quite right. Thank you.
Thank you.
Thank you. Very nice of you to have come here all this way, and I truly am grateful. And I wish and pray that the truth will come out, and
I hope so.
Your campaign will succeed in the end, and Elsie's law will come into place.
Thank you.